Hello, everyone. My name is Abhinay Tumati. I'm currently a first-year general surgery resident at New York Presbyterian Weill Cornell, having graduated medical school earlier this year from Stony Brook. I would like to thank SAGES for giving me the opportunity to present my research. Today, I'm going to be discussing pregnant patients requiring appendectomy, comparison between open and laparoscopic approaches in New York State. I do not have any relevant disclosures. During the course of pregnancy, nearly 1 in 600 to 1 in 1,000 of all pregnancies are complicated by acute appendicitis. Current SAGES guidelines recommend laparoscopic appendectomy as the treatment of choice for pregnant patients with acute appendicitis, regardless of trimester. However, this recommendation has been called into question following the publication of large-scale studies that have suggested that laparoscopic appendectomy contributes to higher rates of fetal demise. As such, our aim was to investigate the surgical and obstetrical outcomes of patients undergoing laparoscopic versus open appendectomy in New York State. To go about this, we performed a retrospective analysis utilizing the New York Sparks database. Our inclusion criteria included all pregnant patients diagnosed with acute appendicitis who underwent appendectomy between the years 2005 to 2014. Our exclusion criteria included males missing identifiers, duplicate records, multiple gestation pregnancies, and patients undergoing appendectomy for causes unrelated to acute appendicitis, such as malignancy. Our two primary endpoints were surgical outcomes and obstetric outcomes. Surgical outcomes were based on the 30-day non-delivery readmission rate, appendectomy complications, and hospital length of stay, while obstetric outcomes were predicated on fetal demise and a composite maternal outcome measure, which was comprised of antepartum hemorrhage, chorioamnionitis, preterm delivery, sepsis, and cesarean delivery events. In our study, 1,006 pregnant patients met the inclusion criteria between 2005 and 2014. In terms of surgical outcomes, this table shows the breakdown of cases by operative technique, stratified by severity of appendicitis, as well as the trimester the surgeries were performed. Our data shows a transition in preference from the laparoscopic approach during the first 2 trimesters to favoring the open approach in the 3rd trimester. When looking at the 30-day non-delivery readmissions and surgical complications by operative technique, there was no difference between the laparoscopic and the open approach. Extended analysis of our data suggests that surgical complications arise based on the complexity of the patient's underlying pathology, with complicated appendicitis cases having a 5-fold greater likelihood of experiencing surgical complications when compared to patients with simple appendicitis. Importantly, the hospital length of stay was significantly different between the 2 approaches, with patients who underwent the laparoscopic approach having a shorter length of stay. To identify independent predictors of length of stay in this cohort, we performed a multivariate regression analysis, which showed us that those undergoing open operations, appendicitis complicated by perforation, abscess, or fecal peritonitis, or being operated on in the 3rd trimester, as opposed to the 1st or 2nd trimester, all contributed independently to longer hospital stays. 2 broad types of obstetric outcomes, fetal demise and composite maternal outcomes, were measured and stratified by the type of appendectomy and severity of appendicitis. Based on this classification, we noticed a peculiar pattern. All 3 cases of fetal demise that occurred in our study period took place in the laparoscopic appendectomy group. One of these patients had complicated appendicitis, while the remaining 2 cases had underlying simple appendicitis. However, there was no statistical difference in the frequency of fetal demise when comparing the 2 surgical approaches, with a p-value of 0.26. Because of the low frequency of fetal demise, No multivariate regression model was built for this variable. To better understand what factors impacted the composite maternal outcome, a multivariate regression analysis was conducted. The regression model for composite maternal outcomes did not show any statistically significant outcome differences among the types of surgical approaches, appendicitis, or trimester during which the operation was conducted. In conclusion, since the laparoscopic approach decreased hospital length of stay but did not statistically increase the risk of fetal demise, adverse obstetrical and surgical outcomes, or 30-day non-delivery related readmissions, we not only support current SAGES guidelines, but also demonstrate that laparoscopic appendectomy offers a marginal advantage over open appendectomy. I would like to acknowledge and extend my sincere thanks to all of my research mentors, including Doctors Pryor, Talamini, Spaniolis, Gary, Dosmo, and Yang, for their mentorship and guidance during the course of this project. Thank you for listening to my presentation. I'm happy to answer any questions through the platform, or feel free to forward any questions you may have to the email below. Thank you.